Abuja, Nigeria's federal capital territory, a city purpose-built to project order, ambition, and the promise of a modern nation. But every morning, before the traffic builds and the offices open, something else happens here. What you are watching is not from a remote village, nor from a rural community. This is happening inside Abuja every morning in plain sight. Open defecation. Nigeria has the highest number of open defecators in Africa. Over 46 million Nigerians, according to UNICEF, practice open defecation every day. In a city that houses the seat of government and represents the nation's image to the world, a silent crisis continues to thrive in plain sight. And despite years of interventions and billions spent on sanitation programs nationwide, the practice remains a daily reality for many residents of the FCT. In different areas of the FCT, public toilets are either non-existent, broken, or too far away to matter. Just a few kilometers from the heart of government lies Mabushi, one of Abuja's busiest labor hubs. Every day, hundreds of artisans, laborers, and job seekers gather here in search of work. But behind the daily hustle is a basic challenge many face. Where do they answer nature's call?
My name is Ya'u Abdullahi. There is none at all, to be honest. There is no provision from the government, to be honest. We only use our money to go to the village to use the toilet. Even if we request for it, they won't provide. In fact, we requested, yet they haven't provided. We want government to make provisions and to also stop harassing us. Most times we face harassment here, even though we are out here for survival, we get arrested. Honestly, we would prefer a facility that is free of charge, because not all can afford to pay for such services. Most people are poor. If it comes cheap, a poor man can afford it. Let's say something between 50 naira to 100 naira. That way, everybody can afford it. We pee over there, but when it comes to toilet paper, we run to the village. In the past, there was a toilet over there at the Kaduna Park, but it has been demolished by government. Environmental refused to allow it exist. They insisted that it must be demolished. There is another one under construction over there, but it is yet to be ready. Anywhere around here you decide to help yourself gets you into trouble. And the other end has been fenced. It means one has to go to the village to help himself. We will be glad if provision is made, and we will appreciate such gesture. If they provide and ask us to pay 50 or 100 naira, then it's okay. You see, at the village, it is 200, and if there is a provision here that will cost us between 50 to 100 naira, then it's fine. Not at all. No provision around here. If we need water, then it has to be sachet water. To be honest, our major challenges here are lack of toilet facility and access to water. We equally have challenge of shelter. When it rains, we have challenges here, so we need shelter. Concerning toilet, Anywhere we squat to ease ourselves, it becomes a problem. We get arrested by government officials and get punished too. Meanwhile, it is their problem because they refuse to provide us with facilities. The only option we have is to run to the village, pay money, and use the facility down there at the village. Government has never come here to offer us succor. Also, concerning water, there is no access to water here. If we need water, we have to buy. Government did not help us in this regards. Our desire is for government to assist us, to come to our aid. We left our homes far off just to fight for survival, and we are suffering. In fact, even where to lay our heads is a problem.
Ironically, this sanitation challenge exists within sight of the Federal Ministry of Environment, an institution responsible for environmental management. Yet, for the people who gather here daily, access to basic sanitation remains a luxury. Our investigation uncovered multiple locations where open defecation continues unabated. What may appear to be isolated incidents tell a much larger story. A story of inadequate sanitation infrastructure and limited access to public conveniences. For public health experts, the consequences are far-reaching.
Open defecation, first of all, that means defecating in an open space, lack of use of toilets. So when you look at the health consequences, it can be directly on health or indirectly. So directly on health, you can think about acute infections such as diarrhea, dysentery. You can think of even polio, hepatitis A and E. They are all linked to direct acute infections from open defecation. Now, when you're looking at chronically, this can cause malnutrition because they are constantly having diarrhea and passing out the food they are supposed to consume. So they start having malnutrition, stunting in children. So all of this can directly impact their health. Indirectly, you're looking at the environment. In the environment, what can happen? This defecation will be in the land. It will affect the composition of the land, and then of course it affects food and all of that. Then it affects water. It pollutes the water, and you're not getting good water anymore. So this will eventually affect the food that you consume and all of those things. Now, even infestation of those vectors, now flies and rats, rodents, they will now be propagated, and you have so much more of these things that will carry those organisms from your feces to your food. Especially, let's talk about typhoid that is very rampant in Nigeria. Everybody thinks malaria, typhoid is the next thing. So of course, that typhoid we're talking about is essentially that you ate feces. So those are some of the things that can affect. Also, in the social aspect, you can think of gender-based violence, because for a woman, if somebody sees you going to go outside, it may just attract the wrong attention to you and all of that. So those are the things you consider when you think of the health impacts of open defecation. It's tiring, let me say. It's monotonous. You're doing the same thing over and over again. And as a public health physician, we always look at doing things from an aspect that attends to more people at once instead of doing one at a time. So when you look at people constantly talking about typhoid, when you look at constantly doing campaigns for polio and all of those things, and diarrhea diseases and deworming, you know that it's all linked to open defecation. And it can be stressful just going about the same thing over again, when we know that we can just approach it at the broad spectrum, putting sanitation services in place that can attend to all of those things. That would be very amazing. That would be a very good one if they will be committed, because political will is very important if you want to achieve anything at all, especially in a country like Nigeria. So we have to look at it first of all. What can we immediately do and what can we do later? Because if you look at all of this, it's eventually linked to poverty. Open defecation is one of the metrics that international organizations use when they are trying to assess countries that are fighting against poverty. So if open defecation is rampant, you know that poverty is very high in Nigeria. So what I would say they should do first of all is to avail infrastructure that will help in sanitation. Now we're talking of water supply. I know that in Amak they're having a very good effect here, but I can't say the same about other area councils. Now, especially the availability of toilets. You can see commercial buildings, markets, and you can see maybe you'll see a very few number of toilet facilities, and they may even be very distant. So if you can put in legislation in place that, okay, environmental, whenever they are approving such buildings, there should be available toilets, considering the number of people that should be using those buildings, and then should be close and accessible to people. It should also be affordable, not as much be considering between using the toilet or eating food. So it should be a price that somebody can pay just for a little bit for maintenance. But those are the initial things. They should do legislation and be able to ensure that these things are put in place, enforcement, right? But you cannot do all of those without providing it, first of all. So it should be in place, infrastructure should be in place. Then, as a long term, if you really want it to last, you need to educate the people. I will not say just awareness, but if people are educated, they make better decisions. You and I, we cannot be pressed somewhere as a result of emergencies, and then we suddenly go and bend down outside. So when you are educated, it gives you a certain level of exposure, and you will not carry out some form of things that, you know, are not in place. So education will give them better earnings also, to be able to afford buildings that have good toilets, to be able to think of putting those structures whenever they are making their buildings. So on a long term, we want to achieve this, we should be able to educate the people and alleviate poverty in Nigeria. If there are more toilets, there will be less demand. There will be less demand on the available ones, right? And people will know, especially those that are having emergencies, you can easily approach those toilets. The amount will be fair because the demand is not as much, and then it will not hamper your availability at facilities, because you know that if I go there, at least there will still be somewhere I can make use of. So more toilets, better sanitation.
Authorities acknowledge the challenge. At Buhari Area Council, sanitation officials say efforts are ongoing to discourage the practice and improve environmental health standards.
Well, the Area Council has been doing a lot, and they are still working tirelessly to see we overcome open defecation. We collaborate with Water Aid, that is water sanitation, through some of their programs and other partners that comes in. And also through the advocacy. We embark on advocacy to rural communities to see the village head and the hakimis in the various villages and the various wards. In Buhari Area Council, we have 10 wards. So far, through the intervention of Waterhead, we collaborate with them. We have about almost 5 toilets. Some they rehabilitate, some they build in the strategic positions. And also Ministry of Health, we also collaborate with them that we have a public toilet being built in Bazango, that is NYC Junction in Cuba. So these are the ways that we have been working tirelessly to see that we eradicate open defecation. We have not started sanctioning people that have been caught doing the open defecation, because most of them, they did that in the night. In the night, they defecate in the gutter, but through our public awareness. But the only sanction that we sanction people, if you have a house and you doesn't have toilet facilities, that is when we come in. We give you a time frame to have your sanitary conveniences. If you don't, then we don't have any option than to take you to court. We sanction you. And you must have that. Even the court is giving you fine, you pay the fine, and you must construct that under environmental health officer's supervision.
But while enforcement and awareness campaigns continue, many argue that lasting solutions require more than education. They require infrastructure. As the search for solutions continues, our investigation uncovered another layer of the sanitation challenge. Scattered across parts of the Federal Capital Territory, are abandoned public toilet projects, facilities that were meant to provide safe sanitation for residents and help reduce open defecation. These structures now sit incomplete, unused, and gradually deteriorating. Their condition raises questions about what happened to a project once presented as a major step toward improving sanitation across the FCT. In 2022, the Federal Capital Territory announced plans to construct thousands of public toilets across markets, parks, and public spaces within the 6 area councils. The initiative formed part of Nigeria's commitment to the universal sanitation goals and the national target of ending open defecation by the year 2030. But years later, several of the facilities remain unfinished. Our findings show that the FCT Rural Water Supply and Sanitation Agency, RUWASA, disengaged one of the contractors responsible for constructing some of the public toilets, citing contractual issues. To understand the circumstances surrounding the terminated contracts and plans for replacing the abandoned projects, we sought an interview with officials of FCT RUWASA. The agency declined to comment, leaving many questions unanswered. In the nation's capital, open defecation remains a visible reminder of invisible gaps in development until access to sanitation becomes available to everyone. The bushes will continue to serve as toilets, the health risk will remain, and the crisis many choose not to see will continue to grow in plain sight. For now, the question remains: how can a city aspire to world-class status when one of humanity's most basic needs remains unmet?